Hello and good afternoon, everyone. Welcome, and we will be giving attendees a couple of minutes or so to join. Thank you for joining us today. Hello again and welcome, everyone. My name is Tom McDermott, and I am the Senior Regional Resource Director at Caron Treatment Centers located in Pennsylvania. Thank you for joining us today's webinar on the topic of the power of presence, building patient awareness through mindfulness-based stress reduction. As a reminder, we will be conducting this session in webinar format, meaning all participant microphones will be muted. We will not be able to see or hear you. During the presentation, please utilize the Q&A feature to ask any questions. Depending upon the volume of questions, if we can't get to your question before the end of the hour, we will have someone from our team follow up with you directly. Additionally, the slides and recording of the webinar will be emailed to you within 14 days of the program to the email you registered with. Today's presentation is eligible for one continuing education credit. We would like to thank our educational partner, CE Learning Systems, for assisting in providing these credits through co-sponsorship with the American Psychological Association. Please note that in order to receive your credits, you will need to be on for the duration of the program and complete the post-webinar evaluation. A link will be emailed to you directly after the presentation from cego.com. After finishing the evaluation, you will have immediate access to your certification of completion. Today, I am proud to introduce our presenter, Kate Appelman. Kate is the Senior Director, Clinical Practice and Professional Development, with a major focus on improving programs that support Caron's clinical teams. Since 2013, Kate has been active in program development, supporting Caron's evidence-based clinical programs for executive healthcare professionals, attorneys, and those with an opioid addiction. Her areas of expertise include motivational interviewing, working with family systems impacted by addiction, relapse treatment and prevention, and men's addiction treatment and recovery. Prior to taking on this role in 2022, she was Senior Clinical Director of Men's Services, overseeing treatment programs and services. Kate's tenure at Caron has allowed her to receive training in addiction interaction disorder and professional development. She is a certified clinical supervisor and certified advanced alcohol and drug counselor, and holds CSAT and CMAT certifications. I will now hand the presentation over to Kate to get us started. And again, thank you for joining us today. Take it away, Kate.
Thanks so much, Tom. Happy Friday, everyone. It's been a long week for many of us, and I'm glad to end it with many of you. So welcome today. We're going to end about 10 minutes before the hour to have some time for Q&A and see where we end up. Let's see. All right, so let's get started. So learning objectives. The first thing that I will say is I have gotten training in mindfulness-based stress reduction, I want to say about 10 years ago. I use it in my personal life. I use it in my clinical practice, as well as supervisory practice here up on campus and in our regions. And take what you want and leave the rest. There's aspects that mindfully I really struggle with. The story I will start with is one from last week where I struggled to get my kids to daycare and get to work because I couldn't find my keys. And after my husband came home, they happened to be in the ignition of my car. So when we look at mindfulness, one of the things that we're going to talk about is the concept of non-judging and the concept of acceptance and patience and all of those fun things. And I think that we're all works in progress. So if you can relate to being a work in progress, you're probably in the right webinar today. So learning objectives, here's what we're going to talk about. I am a big fan of research and knowing that the evidence-based approaches that we're putting into place make sense, that research shows that they make sense, and that our experiences show that as well. So we'll start with talking about reviewing some research that really supports the use of mindfulness-based stress reduction. We're going to talk a little bit about the attitudinal foundation. So what is at the basis of MBSR? And then next step is what do we do with that? So we'll talk a little bit about ways to implement MBSR into our practice for our clients, both formally and informally. Lastly, we'll also talk a little bit about some mental health considerations as we look at how we want to integrate MBSR maybe into some of our services. This is one of those webinars that I wish was in person because it would be great to hear what's working and not working within some of your systems and with your clients. So as you have kind of questions and comments that come up, just put them in the box and we'll talk about as much as we can at the end of this. So the first question is really, where is my attention? So let's take a moment just to arrive. For many of you, you may be sitting at home in front of your computer and taking a break from work. You may be sitting in your office and have lunch sitting in front of you and are trying to kill two birds with one stone by taking this webinar, getting a CE, and also getting some lunch in. So for a moment, I want you just to focus on your breath in and the sensation of your breath out, and really allow yourselves to arrive here. A lot of fun things we can talk about over the next hour. What is it that you need to take in to allow yourself to be present, to let go of, to allow yourself to be present, and just be here with each other virtually. So let's talk a little bit about mindful awareness, the state of receptive awareness that enables us to pay attention to what's happening right here and right now without judging it. And that judgment piece is difficult for most. And we'll talk about what that looks like and why. So why mindfulness? I think about the amount of evidence-based practices that many of us know and utilize in our approaches, whether it's, the gold standard cognitive behavioral therapy, motivational interviewing. There's a lot of different types of mindfulness that we can integrate into our services, not just mindfulness-based stress reduction, but also mindfulness-based relapse prevention or mindfulness-based cognitive therapy. So a lot of different nuances. We're going to specifically be talking about concepts related to MBSR today. And there's a lot of overlaps with some of the other mindful elements to what it is that we're implementing. So I asked myself, why? Why do we talk about mindfulness? Why do we use it? Why do we use it as an adjunct in some of our practices? The truth is, when we look at it, it's just good for you, right? So again, in looking at some different aspects of research, really just acknowledging that the fact that when we look at different trials and research studies, we know that MBSR very much, or mindfulness very much impacts symptom management, mood, quality of life. So when we have typical symptoms that come in front of us, especially if we're working in the field of addiction and mental health disorders, we want a lot of symptom reduction and really looking at what are some of the coping skills that we can help our clients put into place to help reduce their symptoms. We also very much want to impact a quality of life. When we look at recovery, we really look at recovery as a better quality of life for people day in and day out. and mindfulness-based interventions really show to be effective when it comes to that. It also relieves stress and anxiety. So when we look at the decrease in cortisol levels in the body, the more reduction in cortisol levels, the more we're able to relax, reduce stress. That when we look at rewiring the brain, really making it respond better by relaxing rather than stressing. MBSR really helps kind of promote some of that. Whether you have a client in front of you that has a diagnosable anxiety disorder or not, or just has symptoms of anxiety, worry, stress, racing thoughts, a formal practice of meditation actually helps with all of those pieces, including improved sleep. So I had the opportunity to be a relapse therapist for about 7 years, and one of the things that I asked clients as they came into treatment was, what are some of your common reasons for use? And if you think about the clients that you have in front of you, what do you typically hear? I hear things like, I'm struggling with sleep, I'm struggling with pain, I have anxiety, struggling in relationships, I have pain issues. So as we look at why mindfulness really touches on a lot of those elements. Again, when we look at pain and pain reduction, studies show that mindfulness practice has allowed people suffering from chronic pain to decrease their medication intake or even eliminate it altogether. So there's some information in here about the ability to increase quality of life and reduce pain, insensitivity, and depression symptoms that come along with pain. The experience that I've had in treating clients with acute and chronic pain over the years, I know that there is medication management. We look at group process and different types of therapy, but also mindfulness and in conjunction with seated meditations, movement type meditations, yoga and mindfulness as it relates to chronic pain. I had the unfortunate event a couple of years ago where I tore my ACL, actually playing soccer. And after my surgery, I went through physical therapy, and the mindfulness practice actually helped me reduce the amount of pain meds that I was on post-surgery. And I hear that story frequently. Again, when we look at ways that we really want to look at incorporating some of these pieces, there's a lot of efficacy as it relates to issues around pain. It also decreases the likelihood of depression. So when we look at mindfulness practices really helping to increase serotonin levels in the body, we all know that serotonin is kind of that feel-good chemical. It's the piece that gets released when we get a really good hug or when we have really good belly laughs with friends or coworkers. So serotonin, the more we have, the less we struggle with symptoms of depression, because it really helps us with increasing positive mood. There was a study that was done actually this year that really talked about MBSR being effective in reducing depressive symptoms, both in older adults and younger adults, which I thought was really interesting. It also helps boost the immune system. So as we look at some typical chronic issues, one of the things that is really interesting is looking at the fact that when we have stress, less stress-related chemicals in the body, it actually helps us to look at using healthy coping strategies to be put into place as a result of. So it's proven to be effective for a lot of different physical ailments that we know come in conjunction with addiction frequently. So if you look at the clients that are in front of you, either on an inpatient, outpatient, coaching basis, really asking yourselves, how often are some of these comorbid struggles happening with our clients? I know here at Caron, we really look at somewhere around 85 to 90% of the clients that come in with addiction also are struggling with a mental health or a physical issue. So as somebody is really focusing on how it is that they want to reduce some of their symptoms of addiction, mindfulness can really help reduce some of those other symptoms that can be noise and a lot of internal volume that occurs in the midst of treatment as they're trying to manage their symptoms. It improves concentration and focus. This one is incredibly important. When we think about concentration and focus, I think about my feet and my mind being in the same place at the same time. So when we look at things like relapse prevention, improving quality of life, improving connections with those around us, being really intentional about how it is that we're spending our life, not just our time, but really our life. I think that as we look at improved concentration and focus, we can really wed ourselves to the moment, because the amount of times that clients, us, people in general, really struggle with too much focus on the past and too much focus on the future, we really forget about today. And really good relapse prevention is about today. Really great quality of life and being intentional about what to do to improve quality of life is about really being able to focus on the today and being intentional about that. So I think that's another piece that when we really look at the why, I always ask the question, why do that? Is that best practice? What is evidence-based about that? Research really shows that mindfulness really has an impact on people and their treatment and quality of life. So let's talk a little bit about some of the attitudinal foundations. What are those cornerstones of mindfulness-based stress reduction? So what we're going to talk a little bit about are some of these concepts: non-judging, patience, acceptance, what it means to non-strive, trust, the whole concept of letting go, and beginner's mind. What's interesting about many of these concepts is the fact that our society doesn't always tell us that they're really good, right? So one of the things that comes to mind for me is for if you're on this call and people come into your office, there's certain things that they're expecting of you, right? They may come in and be really struggling with kind of managing their affect, managing their lives, really making some changes. So they come to you and as the expert. So when we look at really balancing expert and beginner's mind, it gets really interesting and curious. So we'll talk about that a little bit. The other concept that's interesting from a societal standpoint is non-striving. We come from a culture that more is better, right? If you have a high school diploma, you maybe get a bachelor's degree. If you go on for your bachelor's, how about a master's degree? At that point, you may as well just go get a PhD. There's this striving of where I am today is great, but where do I want to go? How do I want to make it better? Where do I want to be? So that concept is one that's really ingrained in our society in a lot of ways. And some of the feelings and thoughts that come along with that for our clients can be really confusing. So we'll talk about maybe how to hinge on some of these elements to make it really effective for clients. So non-judging, this is an interesting piece. So we all carry around critical voices in our head. It's the committee in our minds. It's the voices that pass judgment on ourselves and other people. It's that internal critic, right? And those internal voices and thoughts, they're just a part of our judging mind. They compare, they assess, assign value, they categorize. And if you think about it, categorical thinking is really how we make sense of the world, right? So if anybody on right now has kids, think about the development of children's brains as they go along. I am fortunate to parent several children that are 19, 13, 3, and 1. And when I look at just where they are developmentally, the truth is that when we really look at the at brain development, we all know the prefrontal cortex is the last part of the brain to be developed, right? This is why our teenagers make really poor decisions, and we want to help slow them down with decision making. But this is also why a 3-year-old, a 5-year-old, a 6-year-old, part of the way that they're developing is they need to categorize things. It's either yes or no, it's black or white, it is or isn't. That's how they make sense of it. Well, the same thing happens for us, right? So I think when we look at judgment, our brains are really hardwired to judge. Part of mindfulness-based stress reduction is really looking at how is it that we can help our clients or even ourselves create that pause to suspend judgment. We can judge, let's just hold off a minute. Maybe there's a part of the story that we don't know. Is there a way that we can replace judgment with curiosity? So this is one of those pieces that as we go and really look at some of the formal and informal practices, non-judging is huge when it comes to mindfulness. And part of mindfulness practice is learning to observe the thought, really just label it thought, and beginning to suspend that judging, letting go of the comparisons with other people. And really thinking about not necessarily where we should be, but just where we are. Are we good exactly where we are and how we are? So just becoming more aware of that judging self, allowing ourselves to get curious about it, and maybe choosing to suspend that judgment and really ask ourselves, what story am I telling myself about this? I think one of the interventions that has been really helpful for me is really asking clients to fill in the sentence, the story I tell myself is, right? The story I tell myself about this situation is, the facts are, right? So you can kind of see how mindfulness-based stress reduction couples really nicely with cognitive behavioral therapy, which obviously is a gold standard in our field. This piece is interesting to me. I talk about patience a lot. If anyone knows me personally, you know that this is a work in progress for me in many different ways. I actually tell clients about that, especially those that struggle with perfectionism and wanting things kind of on their own time. I did an individual session with somebody earlier this morning, and patience was actually one of those things that we had talked about a lot. So when we talk about patience, we really talk about allowing things to unfold at their own speed rather than trying to control or micromanage the experience. It's really easy to do when things are going well. It's a lot tougher when things are not going our way. It can help us accept the fact that our minds do tend to wander, but it's okay. Like, we don't have to get caught up in the travels of the wandering. I read this really great book a couple of years ago. It's a great read if you're interested in it. It's called 15 Commitments to Conscious Leadership. And really what the premise of the book is, it really talks about the concept of living above the line or living below the line. Living above the line is the ability to really practice a lot of the things that we're talking about today. Below the line is when it comes to patience, I think about living above the line as, really allowing things to unfold as they are. Living below the line is really living out of fear. And when I'm afraid, then I control, and I try to control the outcome and really manufacture change on my time with my outcome. When I struggle with patience, I'm very much below the line. So above the line is being curious and allowing things to unfold exactly the way that it does, even if the timing of it doesn't feel comfortable for us. Now think about how that plays a role in recovery efforts. We talk to our clients about patience frequently, and if they're going to any kind of recovery support groups, I'm sure patience comes up with them frequently. MBSR can play a huge impact on patience. Beginner's mind. So as adults, we have this tendency to believe that if we know, it prevents us from the fact that we know things actually prevents us from seeing things as they actually are. So I think about the quote, knowledge is power, right? So that quote I've heard, I don't even know how many times in my life. Knowledge is power. When we think about the power of knowing, again, when are the times in our life when we feel like we need to know things? I think as a parent, there are times when it's assumed from my children that I just know. I know the next thing to do. I know the right thing to do. I know how it should be planned. I know. As a therapist, that same sense of knowing can very much be an expectation that's put on me by clients, right? Because when you look at the power the power dynamics within a therapeutic relationship, when patients don't know, they come to us because they expect that we know. Sometimes we get paid to know, right? So the concept of a beginner's mind really is, I may be in a situation very similar numerous times over my life, but I have never been in this very moment before. I am just as much a beginner to this moment as everyone on this webinar, as anyone in this world. No one has sat in this moment before. So when we can start to really apply that attitude to our practice and our relationships with others and to our lives in general, we can actually start really we can let go of the preconceived notion that we always need to have the answers. This is one of those elements where earlier in our career, there's this belief that like we should know things, right? And the more mature we get, maybe the more spiritually fit, maybe the more we realize that we don't know what we don't know, we acknowledge that it's okay to not know. The concept of a beginner's mind really allows us to be receptive to new possibilities, and it prevents us from getting stuck in the rut of, I see this in front of me. If it walks like a duck, if it talks like a duck, it's probably a duck. Well, what if it's not? Part of beginner's mind is really looking at the fact that there can be a lot of different possibilities of what's happening in this very moment. So all of a sudden, when we start to really practice that as practitioners, and we teach our clients to practice that, can you imagine how much possibility opens up in our therapeutic sessions? Because the reality is, neither one of us have been in this very moment ever before. So there's so much possibility. And then when I get curious and I start asking questions, I learn more from my client instead of believing that I know, which leads me to asking less questions. Again, looking at these concepts, knowledge isn't always power. Sometimes there's a lot of power in not knowing and allowing ourselves to be curious. The non-striving piece is interesting. So we spend a lot of our lives trying to get somewhere, to be someone, to achieve something, to do something. The concept of non-striving is, what if we're okay exactly where we are? What if we're okay exactly where we are? So having an attitude of non-striving really makes it, or having an attitude of striving makes it difficult to be in the present moment. And how many times do we hear our clients say, when I get out, I will. Once I have X, then I'll do Y. As soon as I get my marriage back together, as soon as I start this new job, as soon as I lose 20 pounds, we hear all of these pieces, and I don't judge that because I think a lot of the same things. As soon as then I will, right? So what if we're okay exactly where we are? So when we talk about really practicing mindfulness, we begin to let go of this notion that we're not okay exactly where we are, exactly who we are, that there's somewhere that we need to go or achieve or something that we need to do. What if we're good exactly where we are? And what if this moment actually gets better because we fully arrived to it? So really thinking about like that concept and starting to think about how is it that we teach people in our practices around some of that. I won't talk about acceptance a lot because I think we talk about this all the time in treatment, in our practices, but really acceptance simply means that you've come around to a willingness to see things exactly as they are. We probably spend, I'd love to know a percentage of time that we spend in our practices helping people with acceptance, acceptance of things that we have control over, those things that we really can't change. Serenity prayer, knowing that the wisdom to have the difference between the two, to really know the difference between the two. So when we look at mindfulness, acceptance is one of those pieces that ends up being a byproduct of mindfulness. This whole concept of letting be and letting go, actually in a session this morning talked a little bit about this element where when we think about the concept of emotions, right? So when we really look at our inner experience, we discover that there's certain thoughts and feelings that we want to hold on to, and others that we want to get rid of and avoid, right? So as we talked about feelings in our session this morning, one of the things we talked about was really looking at what are the emotions that as they come up, we go up, we want to think about them, right? And try to understand why we're feeling the way that we're feeling. And then we go out, right? So if I feel a certain way and I'm uncomfortable, I want to figure out what that feeling is. And then I go out and look at why am I feeling this way? And can I change what's happening out there so I don't feel like this again? The concept of mindfulness looks at, instead of going up and out, what if we went down and in, right? What if we went down and instead of trying to figure out the feeling, what if we just experienced it? What if we focused our attention not on the why is this happening, but more on the what does this feel like? So that it brings us into the moment, really looking at some of the bodily sensations that we have, right? And then also not just going down, but actually going in. So looking at, what does this internal experience feel like for me? Because the truth is, when we're in a good spot, whatever's happening out here, our reaction to it is something that we really own, right? So looking at the letting be and letting go in meditation, we intentionally put aside the tendency to elevate some aspects of our experience and to reject other aspects. What if it was the way that it was? So letting be is almost this way of letting things be exactly as they are and accepting that things exactly as they are. So letting be and letting go is very similar actually to acceptance. So developing formal and informal practices. Some of this can be for ourselves, some of this can be for clients, our kids. Take what you want and leave the rest. So formal practices, this is not an extensive list or an exhaustive list. These are some examples of formal practices that we use with our clients up here on campus. So if you're somebody who is an aftercare provider to Caron, they may have experienced some of these elements. These are also some practices that we have in different pieces of our curriculum that we use in session, and that can be good follow-ups or preliminary pieces that you can use. So when we talk about seated meditation, the MBSR training that I went through really talked about this concept of when you really arrive somewhere, thinking about seated meditation as soft in the front and strong in the back. So as I teach clients in treatment about what it means to have a seated meditation, really focusing on posture, I tell them to push their butts way to the back of the seat and consider being strong in the back with posture and soft in the front. Hands wherever they need to go, whether it's on your lap, up, down, doesn't really matter. Both feet on the floor so that there's some semblance of balance. And then we start. So when we look at a formal practice, really looking at what does our posture look like? And even if this means that it's 30 or 60 seconds of just focusing on breath, sometimes just focusing on breath allows us to arrive. There is a formal practice called soften, soothe, and allow. Man, that's a really good one. So what's nice about this is if you have a client that's really struggling with emotions that are coming up, that feel unmanageable for them. They struggle with emotional regulation and really being able to fully experience the emotion, but then also be able to bring it back. Soften, Soothe, Allow is a really good guided meditation that really looks at creating an image of the emotion, visualizing that emotion softening, soothing yourself for having the emotion, and then allowing it to happen. So for instance, if I had a phone call with a family member that was incredibly difficult for me, and I was feeling a slew of emotions, angry, abandoned, sad, I may choose to take whichever emotion feels the strongest for me and acknowledge it maybe as a ball in a color, maybe it's red. And as I soften that emotion, I start to think about how do I smooth out in a visual some of the lines around the outside of the emotion. Maybe I start visualizing it as really bright red and it starts to dissipate in color over time as I breathe into the emotion and breathe out of it. How do I soothe myself for having the emotion? Many times we have emotions that come up and we don't know what to do with them, and then we act them out, and then we feel guilt and shame for acting them out. Our clients already struggle with guilt and shame. They're really good at it. They don't need any more of it. So how do we give them some language on how to soothe themselves? It's okay to feel this way. This must be really difficult for you. What are those soothing messages that we want to implant in our clients? And how do they allow that emotion to happen? And acknowledge that it's not the beginning and it's not the end. It just is, right? So soften, soothe, allow is a really good visual formal meditation that we can use. I really like the stop meditation, which stands for stop and take stock, take a breath, be open and observant, and then proceed. So the internal dialogue I have around stop is stop, reflect, respond. It creates that pause, right? So we think about this concept of impulse control issues as it relates to addiction, whether it's a chemical addiction, a process addiction, where many times we're missing that space between having the thought and acting it out. Stop is a formal meditation that creates that space for people. How do I stop and take stock of where I am? How do I take a breath, create the pause? Am I open and observant of what's going on around me? And then can I proceed? RAIN is a really good one as well. It's a little similar to soften, soothe, allow with some nuances. It stands for recognize, allow, investigate, and nourish. And as I go through these, towards the end of the presentation, I have a lot of links that will actually bring you to some of these meditations that you can use either as a resource for your clients or actually for yourselves. Body scan is a really, it's a meditation that is used often in mindfulness-based stress reduction and one that people are pretty aware of. There's all different kinds of body scans. The one that I really appreciate is about, I think the link I gave you is about 15 minutes, but it really looks at the way that the body keeps the score, right? So I think about that book specific to trauma, but the reality is that the body does keep the score. When I'm really struggling with managing my stress, I want you to think about, like, how does your body remind you of that? So if you're struggling with stress, how do you know? For me, I get this kind of feeling right behind my eye. I may have my eye twitch. That happens sometimes. I may get these boulders up on my neck because I hold onto my stress. I may find that the reason that happens is because my breath gets more shallow. I may not know any of those things because I may get caught up in life until I allow myself to stop and do a body scan from my head all the way down to my toe. And it helps me really look at, where am I holding my stress? Can I use meditation and breath to reduce some of that? It helps me know where it is that I harbor pain. It helps me look at, am I focusing on my breath or is my breath too shallow? It helps me really take a gauge on what's going on for me physiologically, and then looking at ways that I can breathe through that. Self-compassion and loving kindness. This is a great meditation for people who really struggle with guilt and shame, that have a horribly negative self-critic. Self-compassion and loving kindness meditations are great for people who have some of those characteristics as barriers for themselves. Urge surfing, if you have people that are really struggling with craving, urge surfing is a great visual meditation that helps people look at the fact that each craving has a beginning and a middle, and then it crashes, and then there's an end. So it really looks at the fact that craving as a reaction, as an emotion, or connected to emotion, has a short kind of half-life, right? So urge surfing can help people with a visual to really get through craving and difficult emotions. There's other guided and visual meditations. The two that come to mind for me are a mountain meditation, when you have somebody who really needs to look at holding their own space. and look at ways of being. A mountain meditation can really do a great job of being with dignity. A lake meditation does a really good job of looking at depth and stillness. And then I have Headspace and Insight Timer in here as two really good resources. So we'll come back to some of these formal practices, but here are some specific examples of formal practices through mindfulness-based stress reduction that we can implement into our practice. I really love this. What are the myths of meditation? What I will say is I was introduced to meditation probably about 15 years ago. I was in my master's program. 15 years, maybe 14 years. I was in my master's program, and the internship supervisor I had was Dr. Bevan. He was a psychologist, and his psychological practice had a huge mindfulness piece to it. So in the beginning of all of our supervision sessions, we would do a seated meditation. And I said to him at the time, you know, Dr. Bevan, I just don't meditate. I can't clear my mind enough for it ever to be able to work. And he said, Kate, that's perfect, because the idea of meditation is not to clear your mind. So at that point, I felt duped a little and started to do it, half because I really appreciated him and respected him, and half because no matter what I did, I wasn't going to get out of it. So when I look at these myths of meditation, it reminds me of myself then, because I had this belief that meditation was really difficult, that I had to quiet my mind for it to really be successful, that it would take years of practice. I know that people have talked about believing meditation is escapism. And it's really interesting because the more I practice and the more I see others practice, it actually, instead of escapism, it allows you to truly be present in what is, and not really need to escape, because you're present in where you are right now. Meditation also doesn't require any spiritual or religious beliefs. When we look at the whole concept of anchoring, it's really anchoring on breath. It's having the belief that the here and now is really important. We don't need to be spiritual or religious to do any of that. Although meditative practices sometimes do vin with spiritual and religious beliefs, but don't need to. And this whole idea that I'm supposed to have this transcendent experience in meditation, that a white light burning bush truly have arrived, transcending experience, and it just doesn't need to be that way. That does happen as a byproduct at times for people, and the fact that it needs to be a cornerstone is absolutely a myth. So when we talk about informal practices, formal practices is really looking at seated meditations. Again, it could be just a few minutes. It could be a seated meditation for an hour or two. That is not up my alley, and it is for some people that is the way that they experience a formal meditative practice that is really beneficial for them. If we talk about informal practices, one of the things that we really talk to patients about, and that I strive to practice better in my life, are ways that, really simple ways that we can really incorporate some of these pieces into our day-to-day, moment by moment. So in the moment, do I allow myself to stop for a minute and just focus on my breath? Are there times when I allow myself to really arrive? I think about the idea of intentional transitions. So if I have meetings back to back to back to back to back, how do I create space, even if it's for a few moments, to stop and really arrive to the next meeting? This was a whole lot easier when our meetings might have been in person. So we had a few minutes of walking time to be able to transition from one location to another. Now, many times we transition from one webinar, one Zoom, one WebEx to another pretty quickly. We may have one client literally walking out of our office and the next one walking in. So thinking about, how do I intentionally transition? What does that look like for me? Can I intentionally breathe in courage and breathe out doubt? Breathe in acceptance, breathe out judgment, even if it's just for 1 or 2 breaths. How mindful are my meals? I say that knowing that it's 12:45 and many of you might still be finishing up your lunches here. How mindful are my meals? I know that I have little kids, so my meals are not always mindful. I try, and the struggle is real. But really thinking about, am I mindful about what goes on my plate? The portion, the balance, what is it that I choose to put on my plate? And then also being mindful of what are the tastes or the sensations or the textures that are happening? Do I allow myself to really experience that? That actually slows down my eating and puts me in a position where I may actually be full before I may realize I'm full rather than eating through my fullness. Mindful walking, really allowing myself to be present, being aware of my steps, my breath, the fact that my body is able to walk, and I have that honor. Just being aware of those pieces. Mindful exercising is a big one. I appreciate spin. I appreciate lifting. I appreciate running. Those are some of the best mindfulness practices that people can have because we're forced to focus on our breath. All of these really lead to, how do I get my mind and my feet in the same place at the same time? I love this. Are you thinking what I'm not? Are you not thinking what I'm not thinking? Because the truth is, when we look at just a few other concepts, a wandering mind is normal. It is the mind's job to secrete thoughts, just like it's the liver's job to secrete bile. We're supposed to have thoughts. Think about them as a ticker tape on a building in Manhattan. Thoughts are going to happen. Sometimes we talk about this concept of putting the thought in a cloud and letting it go. What if we allowed the thought to go and just labeled it thought and just got curious about it? So a wandering mind is completely normal. And just because we have thinking activity doesn't mean that mindfulness isn't working. It actually helps us continue to be devoted on being still. So as a thought goes by, the more I practice, maybe I label it thought and come back to my breath. How do I anchor my attention into the present moment? The one piece that we have is our breath that does not, when we don't have breath, we don't have life. So breath is one of those pieces that is one of the easiest anchors that we can kind of hinge on. When we think about this whole concept of noticing aversion, we can develop the awareness of getting the feel of things and being curious of when we have aversion, what is that about for us? What I really like about this piece is, and this helps with relapse prevention, this helps with a lot of different pieces, is really looking at being intentional about our attention. When we use mindfulness practice, we can be conscious about widening or narrowing the focus of attention. So I want to do something with you quickly to kind of to show this. Now, you may be in your office or at home, and if you have other people around you, they're probably going to think you're nuts, and I apologize in advance. But I want you to, just for a moment, I want you to take your hands and hold them like this. Just appease me for a minute. Hold your hands like this. And on the count of 3, I want you to clap 3 times as hard as you can without hurting yourself. All right. Now, while you do this, you can look at me, you can close your eyes and just listen to my voice. So on the count of 3, clapping loud 3 times. 1, 2, 3. Now, as you do this, I want you to focus on the sensation of your palms. Now move your attention to your left pinky finger. And back to your left thumb, noticing the sensation dissipating over time. Now moving your attention from your hands to the space between your hands and back to your palms. So as we do an exercise like this, really looking at how do we widen our focus of attention and narrow it. Now, if you struggle with attention, the ability to use mindfulness to focus attention on the right here and now that's in front of me helps me with work. It helps me to get tasks done, to reduce procrastination. If I want to widen my focus of attention, it helps me understand perspective, that maybe I don't know the whole story. Maybe it's not just about my experience. So as we look at narrowing and widening the focus of attention, we can find ways to use meditation that can really help support our clients and ourselves in looking at bigger picture and smaller picture. Being an observer, this I think of dialectic behavioral therapy. When we think about the whole concept of wise mind, very similar. Being able to slow things down to see our patterns. And one of the things when we talk about considerations for mental health, there's a lot of elements as we look at stress sensitivity. Our clients may have a hypervigilant amygdala because of trauma, because of stress, because they're withdrawing from chemicals, because of any of those pieces. And as we look at really using mindfulness to improve resilience, we look at the importance of being able to bounce back. So when we directly experience distress, as it relates to trauma, one of the things to really think about is there are times when people will stray away from seated meditation because people are struggling with trauma. And I want you to really look at some of the elements and some of the research that shows that some mindfulness-informed interventions actually significantly show a reduction in some trauma-related symptoms, such as the ones here. So some of the things that we need to be aware of, we know that cognitive variables may increase trauma effects. There can be an avoidance of distress that can increase suffering. So sometimes the use of meditation can reduce the distress that's occurring and having more awareness of it. And as we look at the choice to use mindfulness, we really want to make sure that we're screening. So clients who are subject to intrusive thoughts, flashbacks, rumination, they may either A, not benefit from mindfulness right now, or may need to B, do it in conjunction with another evidence-based practice. So if we look at cognitive processing therapy, EMDR, MBSR can really lend itself to both of those. So I'll leave you with this. If we're looking at putting this into practice for patients, this is a piece that has been helpful for us here on campus and in my practices. So we review a practice log, which I'll show you. We introduce a new concept. We identify a skill that can be used. And then we look at a commitment for the following session. So a new concept could be the concept of letting be and letting go. The new skill could be urge surfing. A new concept could be anchoring. The new skill could be a body scan and anchoring into breath. The new concept could be acceptance. The new skill could be RAIN, recognize, allow, investigate, and nourish. And here's an example of a practice log. So I'll leave you with, here are some links for meditative practices that we've talked about. Here's different resources if you're looking for more information and looking to gain a little bit more awareness. So that's what I have. I will stop there. I went over by a couple of minutes. I apologize. And I'm actually going to turn it back over to Tom for the next portion.
Thank you so much, Kate. That was great. I literally was sitting here doing that practice with you where we clapped and did it. I'm glad that I had my camera turned off though. So we actually do have some questions. So I'm gonna ask them and then you can answer. So how has technology helped people meditate, such as apps? Are there any specific apps that you're aware of?
Yes, that's a great question. So I personally use Insight Timer. I think it's great. And what's beautiful about Insight Timer is there are so many different meditations that you can use. You can do one that's guided, one that's not, one that has background noise, one that doesn't. I personally like a bell in the beginning and a bell at the end. You can also meditate with a slew of other people from all around the country, which is amazing. And it tells you how many people in that moment are meditating like you are. So that's one of the apps that's pretty great. Insight Timer, Headspace is a great one. The other piece is there has been a significant increase in, actually since COVID, the ability to connect with more people online. If you look at research, actually Insight Timer has significantly increased the amount of people that are on it and actively using it as a result of the pandemic. So those are two pieces that from a technology like an app standpoint are pretty substantial.
Next question. MBSR is good for chronic pain. Does it reduce pain, help you accept it, or both?
That's a great question. Both. So when we look at the use of MBSR when it comes to pain, what we find is that it helps. So statistically, statistically from a research standpoint, the amount of pain medication that people utilize significantly reduces with a mindfulness-based practice. So it reduces pain, but it also actually changes our perspective of pain and our relationship with pain, which if anybody works with chronic pain patients, there is definitely a relationship that we have with pain. So if we look at increasing a pain threshold, which is the ability to really be able to manage our pain, that's another piece that kind of comes along with it. So the actual pain, our perception of pain, and the relationship with it, all three. It's a great question.
So we're going to sneak in one more question. So, and then any questions that we don't get to, we will get them answered and send them out when we send a follow-up email. So what strategies can you use to introduce meditation with teens who claim it doesn't work?
Did you say teams or teens like adolescents?
Teens like adolescents.
Teens like adolescents. So that's a really good question. There is a lot of introduction that is happening actually in the school setting, from daycare all the way through elementary school, middle school, and high school, sadly, because I think I have kids in each one of those. So some of that I can say is already being introduced in the school setting at times. Which app is it? So it's not Insight Timer. There are specific apps that are good for children up through preteen. And then when we look at teenagers, we have actually a decent amount of resources in our SAP program that I'll make sure that whoever asked that question, I can get to you. But one of the things that I think about when it comes to introduction into teens is looking at what's important to them and how can mindfulness help them. Example, my 19-year-old is an athlete. He plays soccer. One of the ways that that meditation and mindfulness was introduced to him was actually through the fact that he would perform better when he introduced mindfulness into the way that he played, the way that he trained, the way that he lifted. Those things were important to him. So when he started to practice meditation, it was through that avenue. So the first thing I would ask is what's important to the teen and how can you show and demonstrate that mindfulness can positively impact that?
Thanks, Kate. I'm going to ask you to, if you could send us the list of the apps that you mentioned so we can add them to the follow-up email so the participants here will be able to have access to them as well.
Absolutely. Absolutely.
Well, again, thank you, Kate, so much for your informative presentation and to all of our attendees for joining us today. As a reminder, this presentation is eligible for one continuing education credit. Watch your email for a link from cego.com to complete your evaluation. I'd also like to remind you that the slides and recording of the webinar will be emailed to you within 14 days of the program to the email that you registered with. Caron also has several more exciting events in the works. On January 11th, join Caron's President and CEO, Brad Sorte, and Executive Director of Caron, Florida, Dr. Phoenix Adams, as we wrap up our Countdown to Keele webinar series that has been showcasing the programming we will be opening at our 100,000 square foot Keele Medical Center opening in January 2023. It's like right around the corner. Mm-hmm. On February 15th, we are hosting our continuing education webinar entitled Using DBT Skills and Principles to Address Co-occurring Mental Health and Substance Use Disorders. Please check your email for more details. I'd also like to share that Caron, Pennsylvania is in network with a number of the insurance providers you see here. We continue to expand our access to care, so please do not hesitate to reach out to determine eligibility of benefits. In the meantime, please reach out to your local regional resource director at any time for additional information, resources in your area, or questions regarding admission to any of the Caron programs. Again, thank you again for joining us. Have a great afternoon and happy holidays, everyone.
Have a great day, everyone.